Thank you, Mike, and I'm really glad to be able to talk to you today about this really important subject. And he began by saying you have to have been living under a rock not to know what's been going on in the last month. There isn't a person in this room, I'm sure, who hasn't seen a picture of that child lying dead on the beach. But we have, as a society, been living under a rock for 4 years. Here's another picture that you probably haven't seen, and most of the world has had accessible to it, but hasn't seen. It's a picture of one of the more than 35 chlorine attacks just since February or March of this year. Many, many children have been killed, and the world hasn't paid any attention. And when we look at these 400,000 or 500,000 refugees coming to Europe seeking refuge, we have to look at what is driving this. And that picture, it's the only picture I'm going to show. I could have shown you 24. That tells you what it's really about. In the last 4 years, here are the best figures we have on not deaths. We know the figures on deaths in Syria have been reported as between 220,000 and 250,000 people. But this reports violent civilian deaths. This is around 85 to 90,000 violent civilian deaths. And you can't get caught in a crossfire and end up with these kinds of numbers. These are the result of targeted attacks on civilians. And you see almost 19,000 from Syrian air attacks, mass killings 28,000, mortar rocket attacks 27,000, people detained and tortured in prison almost 9,000. And then the smaller numbers, they may seem small, but almost 1,000 have died from chlorine and other poisonous weapons. And the last category is not by method of death, but who has died. More than 650 health personnel have been killed in hospital and related attacks. So this is the violence against civilians, and this is almost all the Assad regime. We know ISIS is operating in Syria, but this is almost all from the Assad regime. And the sources of violence from these aerial attacks include something called a barrel bomb. In fact, nobody much heard of a barrel bomb until recently. A barrel bomb is a kind of oil drum-sized weapon dropped usually from a helicopter, so it's not very high up. And there's a diagram of what it's like, and you see inside the metal container is shrapnel of all kinds, nails, plus explosives. So it's completely indeterminate and arbitrary in its reach, and it hits whatever it hits. But when they're dropped on a bakery or a hospital, you can imagine the impact. Human Rights Watch this year, back in February, documented 450 sites consistent with barrel bomb attacks in one place, Daraa, and over 1,000 in Aleppo. And it's no surprise then that WHO has estimated the number of traumatic injuries in Syria at over 1 million. And that's pretty consistent with the violent death information. That is a 10-to-1 ratio of injury to death. So this has been going on for 4 years, but it's also escalated. And I mentioned the 650-plus medical personnel. Physicians for Human Rights has been tracking month by month, from whatever sources it can get, the attacks on medical personnel in Syria. The red lines are personnel, the facility attacks are in blue. And what you might notice, and when we think about these refugee flows again, a 4-year war, but in 2015, it's gotten much, much worse. So if you look at the blue lines since January 2015, they're the highest in the 4 years. There was a spike back in 2012, and then there was a decline, one little spike, but it's been consistently high over the last 6 months. So that's what's been going on in terms of violence, and what has the effect been in Syria that is driving all this, all the refugee flows? Now, I'm only focusing, because we're a school of public health, I want to focus on the health sector. I could have chosen education, I could have chosen sanitation, I could have chosen a lot of things. Because I only have 15 minutes, I wanted to talk to you briefly about what the effects of this war and these assaults on civilians have been on the health sector. WHO reports that as of June, 41% of the hospitals are fully functioning, only 41%. Those hospitals, by the way, exclude field hospitals. Field hospitals are essentially secret hospitals operated by the opposition in order to avoid attacks by barrel bombs and rockets. So they're in chicken coops, they're in factories, they're underground, they have to move around, they too are attacked. But these figures only apply to official hospitals, so the figure is really much higher. Once again, in 2015, the number of hospitals hit has been increasing. So the number totally out of service went from 19 to 31 since January. And aside from the hospitals that have been taken out of service because they're attacked, many are inaccessible because it's too violent. They also have severe shortage of medicines and consumables. At the same time, both within Syria and in the neighboring countries, only 37% of the money WHO and other UN agencies says is required has been available. We don't know how many people have died from starvation and non-violent deaths. The Syrian American Medical Society, which works very hard inside Syria as well as in other countries in the Middle East where refugees go, have estimated that those preventable deaths range from 200,000 to 600,000. Stunning numbers. That's why people are going to Europe. Here is the refugee situation. Court Robinson will talk much more about this, but just to give you an idea on how dramatic the flight has been, there are more than 7 million displaced people, 7 million within Syria. Imagine what that is like. 7 million not able to stay in their homes, but not able to leave the country either. And that doesn't count, of course, the 2 million in Turkey, the over 1 million in Lebanon, 600,000+ in Jordan. 1 in 4 people in Jordan, I believe, is a refugee, or is it Lebanon? Lebanon, thank you. So we've had this extraordinary refugee flow, and as Court Robinson will talk about, an inadequate humanitarian response. Now, I want to talk to you finally, briefly, about what this means to the people working there. Last year, in conjunction with the Syrian American Medical Society, I interviewed 27 health professionals, mostly physicians, working inside Syria. And they were working mostly in these field hospitals, providing care to civilians and wounded fighters, whoever came in the door, for trauma care. We try to understand what the impact has been. It's hard to grasp what it's like to work in an environment like that. So I'm just going to share with you a few quotes and then illuminate some of what they show. Well, this is basically what it's like. They are under assault all the time, if not every day, maybe once or twice a month, and they felt like they were working in a place that was like death. And their triage and operating circumstances are such that they just have to carry on. Very few of them have electricity. They work from generators. And so here, one doctor told me he was in the middle of an operation when the barrel bomb hit, and there was a lot of damage, and the lights went out, and the generators went off, but he was in the middle of an operation, but 20 minutes later, he had to return to the operation. But they're faced with these wrenching triage decisions because they're so short of staff, they're so short of supplies, they're so short of electricity, they're so short of medication. So basically, they can't provide any kind of operation, this doctor said, if it's going to take more than 2 hours, or once the beds are filled, and there aren't very many of them, people who could be saved won't be saved. Another thing that's happened in Syria, and this explains the preventable death numbers, in many parts of the opposition-controlled areas, and that's what I'm really talking about, the opposition-controlled areas, primary care, care for chronic diseases has basically ended. Even care for newly or reappearing infectious diseases, including those from waterborne diseases, diarrhea, typhoid, which are reappearing in Syria. It was a very modern country before the war. These are diseases that have never been prevalent in Syria are coming back. So primary care has ended. If you need chronic care, you need chronic coronary care, you need dialysis, you need the kinds of care for cancer that a modern medical system can provide, it doesn't exist. And we've seen the consequences in the death rates. But there's also a paradox. More than one of the doctors told me that one of the facets of practicing medicine in these field hospitals is that people are afraid to come, because the hospital is the most vulnerable place in the community because they are targeted. So even though that's the only place you can get care in these communities in many instances, many people are afraid to come. And so the medical community is itself traumatized, and the Dabka is a dance. Just surviving is a time for celebration. And in all these interviews, I asked them, what do you need? You need humanitarian relief, you need psychosocial support. They need everything. But what they always said is stop the bombing. So when we talk about what needs to be done, it's a mistake to focus alone on the refugee crisis in Europe. It is a crisis, and a lot has to be done. But unless we can figure out a way to protect people from dying, I think it's our job in the public health community to do that as well. And we can't remain under the rock that this country has been under for the last 4 years about this war. And I'd like to just finish with I don't know, I lost my last slide there, but there are four things that have to happen. One is, obviously, humanitarian aid has to be increased. 2, refugee decisions, both in the United States and in Europe, have to be revisited. There's been calls for 100,000 refugees taken by the United States that should be taken by the United States. We have the capacity to do that. The administration is moving kind of in the right direction from 1,800 to 10,000, and yesterday Secretary Kerry said there were going to be thousands more, but we're nowhere near the 10,000, the 100,000. A third thing is there has to be a negotiated settlement, and I'm not going to get into geopolitics, that's not my field, but there's a fourth thing, that if we're going to be serious about protecting people from violent death, or for protecting people from not being able to access health care, they need to be protected now. And it's incredible that over the last few months, the calls for safe areas, for no-fly zones, have been increasing. More and more people with more and more credentials, far more credentials than I have, it's not my field, figuring out what military strategies of protection are. But we know that protection can be had, that those helicopters dropping barrel bombs can be stopped, and there can be limits on what the U.S. and its allies does to prevent total engagement in a war. When we're talking about the level of death that we're seeing, it seems to me that something has to be done. And so I'd like to conclude with a quotation from Rick Stearns, who's the president of World Vision. He says that as the war in Syria now drags into this 5th year, I am distraught by the apathy of the American public. No modern crisis has created so much human suffering, yet so little response. Had Syria been devastated by a sudden catastrophic earthquake, Americans might have responded more generously. But war has a way of turning our heads away from human suffering. And I might say that war in the Middle East especially has the capacity, as opposed to refugees arriving in Greece and Italy. We have to address this. I want to remind you finally of one more quotation. In his book on the Rwandan genocide, Philip Gurevich, a writer who wrote a wonderful book about the genocide, said, denouncing evil is not the same as doing good. So we have to question ourselves about how we, as a nation, can do some good. Thank you.